Hi, everybody. My name is Lisa Kessler from Kessler Insurance, and I am so happy to be here again today on behalf of Cheers for Charity New Hampshire. And as usual, I get the privilege of being here with my friend Joanne Burchuk. Hi, Joanne.
Hello, Lisa. Good to see you. And yes, welcome to another episode of our Cheers for Charity. I'm Joanne Burchuk, and I'm with Lighthouse Physical Therapy. And it is my honor today to introduce Tamera with the Aids Response Seacoast. And looking forward to hearing all about your organization. So, Tamera, please just introduce yourself, tell us what your role is, and a little bit about what your organization does.
Great. Thank you so much for having me here today. I'm excited to share about Aids Response Seacoast with you and with the Seacoast community. So I am the executive director of Aids Response Seacoast, and I've been in that role for almost a year now, but I've been here for almost 12 years. I was a case manager before that, and that is primarily what our organization does. We work with individuals in Rockingham and Strafford County who are HIV positive, and we provide medical case management. ARS, so Aids Response Seacoast for short is ARS, has been providing this work here in the Seacoast for 35 years. Our mission is kind of threefold. Primarily, it is to work with people living and affected with HIV, AIDS, and make sure that they have access to life-saving medications, that they're connected with any benefits, that they are able to see doctors, and if needed, we help them connect with Social Security or Medicaid. We help with food and transportation, all kinds of things that make for a stable life. We also provide education into the community. We have a speakers bureau that will speak about what it's like living with HIV. And then we also like to provide advocacy on a local, state, and federal level whenever possible to advocate for issues affecting people with HIV.
Well, that's wonderful. That's a lot of people that you're able to support in the area. Can you give a little background? I feel like with COVID the last couple of years, like obviously this particular issue never seems to come up anymore, never makes the headline. So tell us about our own community. Like how many people in our own backyards are dealing with this type of, HIV issues right now?
Yeah, thanks for asking that, because we do feel like it has become kind of invisible. And part of that is because HIV has become a chronic disease rather than kind of the very dramatic fatal disease that we all might remember from the 80s and 90s, which we're very grateful for. And just a little bit of background for me, in the early days in the 90s, I worked in a facility, in a group home, but it was really a hospice, and every single client that we had that came to live there died of AIDS in that facility. And so in 1996 was the first time that medications were created that gave hope and a chance to continue living with this. And through the years, those medications have progressed, and they are really, really effective now. And very often someone can take those medications, just one pill once a day, and they can get to a place where the HIV is kind of contained in their body and gets to a state called undetectable. And undetectable means you're also untransmissible. You cannot spread HIV infection to another individual through sexual activities. And it has been a complete game changer. So instead of getting a diagnosis that really was like, get your affairs in order and let's figure out the end of your life, it's like, how can I live with this and how can I live well with this? But a lot of barriers remain in place for people living with HIV, and including the medication is very expensive. And so there's a state program that ARS gives access to our clients to help pay for those medications and pay for insurance and things like that. And then what we have found is that the more stable a person's life is, the more apt they are to adhere to those medications and to be able to live a healthy life. And so through that, it's become really invisible in our communities because you don't see what the face of HIV is. And so I kind of like to share what that is. it's everyone. And that's what the face of HIV is. And if I talk to you about the spectrum of who our clients are here on the Seacoast, I have young people and I have grandparents and I have professional people and I have disabled people. And there's certainly people that are dealing with substance use disorders or mental health disorders, but there's everything in between. And that's always been what's been so remarkable and difficult about HIV is that it's a virus and it's not really interested in anything but a host in order to replicate, and it doesn't care who you are. And so we are so grateful that we can now help facilitate people live their best and healthiest lives as possible, but it still affects a good amount of people. So our agency has at any given time between about 95 and 115 clients, and actually that's been steady for years and years and years. We work with individuals that are at 500% of the poverty level or less. So the majority of our clients are under 200% of the poverty level. And I think that it can be really misleading to look around our beautiful communities and these very affluent communities and not realize that there are so many people that live here that are struggling financially, that are struggling to keep a roof over their head, that have difficulty getting enough food to eat. And all of those factors can address someone's ability to get their medications and to stay healthy. And so that's really our role, is to bridge that gap and try to connect them to all the resources that they need to remain healthy and have the best outcomes.
All good news in that sense, like you said, people aren't talking about it as much because it isn't the deadly virus. And, with medication now, people are able to control it. Is that generally something once people, when somebody starts on the medication, they'll be on that for life. So it's an ongoing issue for the rest of their life. And with rising medical costs and rising prescription costs, that can be very challenging for people without the means for that. So that's great that your case managers and your organization will help coordinate that for people. And you guys do a lot of education there too, as well, right?
Yeah, we tried to. We had been doing a lot more before COVID, and then just like every other thing everywhere, things got shut down. But we would try to work with any local school districts, other not-for-profits, colleges and universities. We've had district church groups that ask someone from our organization to come in and talk to them about what it's like to live like with HIV, and also what you can do for prevention to stop the spread of HIV within the communities. And that's one of the something else that is really concerning to us, is that especially through the pandemic, we're getting new cases, we're getting newly diagnosed people, and lately we've been getting young people. And a lot of times people from other areas or other states that are moving to this area, but with deferred health care and deferred access to education and mental health, we are concerned about a potential rise in cases in New Hampshire.
So can I hope you don't mind if I ask Joanne real quick? Just so if a person finds themselves in this situation, like you said, it could be anybody, right? Anybody, any age, any gender. How do they get to your organization? How do they make the connection? How do you typically getting those 95 to 115, people that you're supporting?
Yeah,
And again,
so
we've heard from the medical facilities. Do they find you online? Like, what's the way to make those connections?
well, to all of the above. So it kind of depends about where somebody's getting diagnosed. We work closely with the Joan G. Levering Center in Greenland, and if they do HIV testing, if they get a positive test, they would refer somebody to us so that we can connect them to resources. Sometimes somebody has moved to the state. They're already HIV positive, and they'll just do a search, a Google search, and find us and call us and connect with us. There's a program we work very closely with the state of New Hampshire Bureau of Infectious Disease. And so there's a surveillance program if someone tests positive at different sites, where they try really hard to connect them to case management. And there's a program called Linkage to Care that would reach out and say, hey, there's a group that can help you here, doctor's offices. But part of that mission is letting people know that we're here. And so on our end also, we need to outreach to medical providers, emergency rooms, to anywhere else that someone might come across that and find out what their status is. And to that end, we also encourage testing. We don't do testing here, unfortunately, because of payment structures, but we can refer out to testing to anyone who needs it. And it's really important to know your status. There's something called the treatment cascade, and it starts with people not getting tested. And so there's an estimate of around 25% of people who are HIV positive probably don't know their status. They haven't gotten tested. The CDC at this point recommends that kind of every adult get tested at least once in their life. And yet I think most of us would find as part of our primary care that no one's asking the question unless you happen to be in a few very high risk categories. So we strongly encourage everyone to get tested and that to identify risks, if that's something that's part of your life, to get tested more often. And then from there, what they found a study showed that when you're connected to case management, you just have chances of much better health outcomes. When you have someone who's working for you and advocating and helping you overcome your barriers, your chances of living with this and negotiating and having a healthy life are just much stronger.
Can we back up just a second? So, I guess I haven't even thought about HIV in a very, very long time, but how would somebody know to even go test for it? Are there typical symptoms that would alert somebody that, oh, I wonder if I have this?
Yeah, so that's one of the things that's really tricky because HIV on its onset someone might have had some type of, had unprotected sex, or if they shared a needle with someone. And there's a chance that at some point you might have felt sick or felt like you had a cold or the flu or something like that. And a lot of people would not necessarily connect the dots because it doesn't necessarily happen immediately afterwards. And then testing would take, so if you had unprotected sex and you went and had a test the next day, that wouldn't be enough time. As well, we're all learning about COVID. It's kind of a similar thing. You need enough time to produce antibodies that would show up in a test. So I think that's one of the issues is that people often don't consider testing, or they don't consider a behavior that they're doing something that could possibly put them at risk. So that's one of the reasons we would love to have a push where it's more just something that is less stigmatized. Let's know what our status is and figure it out, and have our primary cares ask us at our doctor's appointments about that. But that being said, there's groups that you want to test more often, and it's so. Let me back up. Sorry. So what we have found at times that when that doesn't happen, when someone, maybe they have a period in their life that they had, it could just be one partner or they had multiple partners and they moved on and nothing happened physically that made them feel any different. And then years pass and they start to realize they have more fatigue, or maybe they get diagnosed with pneumonia or something like that. And someone finally checks and they find that they actually have an AIDS diagnosis. And what that just means is that their immune system is so depleted enough where that other issues are coming in, making them sick. So it really does get tricky, and it really is something that we would really love to have it not be something that causes this panic, but something that we do just to all of us to take care of our healthcare.
Interesting. You mentioned, people getting tested. And when you said that, it reminded me way back when, like 17, 20 years ago, when I was pregnant, my OBGYN had me tested. They asked if I wanted to, and I was like, sure, throw it all in there, right? And I thought that I was kind of surprised, and I didn't think I was at risk, but figured it couldn't hurt to be tested. But that's the only time it's ever come up in my entire life, in my 53 years. Like, amazing.
And the good news about that is that we very rarely in the United States see to mother to infant transmission anymore. That they do test most mothers during pregnancy, and if somebody is deemed to be HIV positive while they're pregnant, they get onto treatment, and there's different ways that they can make sure that they don't pass on HIV to their unborn child. So that's really, really encouraging that in the US, that's much, much less of an issue than something we might have all heard about years and years ago. But it's definitely other scenarios that it hasn't become as standardized to test for. But I guess the practice is now to ask everyone to be tested once in their life, and that anyone that has unprotected sex with others, and especially men who have sex with men, anyone who uses needles on a regular basis, to try to get tested regularly at least once a year. There isn't a lot of money put into outreach for testing in the state of New Hampshire, and so that does make it difficult. It's not super easy to just go find a place and walk in and get a test. So that's another issue that we would love to see addressed, that it was more standardized and it was easier to find a place to test.
How are you guys funded? Are you mostly supported by government, city, state agencies, or do you rely, a bulk of your finances rely on people's support to donate to your
so luckily our medical case management program is mostly funded through federal and state grants. We've applied to local CDBG grants. And that's great that we're able to, it's kind of considered a necessity, and we're able to provide that through those grants. But it's the rest of our organization that doesn't have funding that we have to fundraise for. So people aren't as fond as like wanting to help pay, for the rent and phones and things like that. And our education, we don't receive any funding for that at all. So that all has to be done on a volunteer basis and through our fundraising.
Go ahead, Lisa. I think I interrupted you last time.
It's all good. Tamera, this is really important information, and I'm so grateful for all the work that you're doing. I would love to just hear a little bit from you about, where do you share information? Do you share it through a social media at all? Is it all just on your website? Do you do newsletters for people who are interested in this topic? What's the way that people can get engaged with your organization?
So we're growing that right now. Me as a new director here, I am learning my way around social media. So we do have a Facebook page that we're trying to update more often. And we've just started an Instagram account, which we are trying to, any events that we're having, we would put those up there. So we encourage everyone to follow us there on our Instagram and Facebook pages. We do have our website, which I have been updating, but we are going to look to kind of try to make that more user-friendly, update it more, have it so it has a better way to connect with us as an agency. So that's a work in progress right now. But I don't have a newsletter that we put out to the general public. We try to keep a lot of information on our website, and then anytime that anyone has questions about HIV, about their particular risk, about testing, about how to engage with services, I highly encourage them to call me or any of the case managers directly, and we would get you connected with any resources needed.
This is fantastic. Well, Tamera, I think that's a great point for us to sort of say thank you very much for your time today. You've given us a ton of really good information, none of which I was aware of in any way, shape, or form. I don't know what you joined, but this was all really helpful
the same.
news, right? Like it was all new
Yep.
information and so useful. And we're so grateful that you took the time to share this with us today.
Thank you so much for having me and listening to information about AIDS Response Seacoast. We appreciate it.